Part 3 NCLEX are a neuro quiz.
21. The nurse walks into the room and notes the male client is lying supine, and the entire body is rigid with his arms and legs contracting and relaxing. The client is not aware of what is going on and is making guttural sounds. Which action should the nurse implement first? L1. Loosen constrictive clothing. L2. Place padding on the side rails. L3. Assess the client's vital signs. L4. Turn the client on his side. 21. Correct answer 4. Placing the client on his side helps keep the airway patent, therefore, it is the first intervention. All the other interventions may be done, but airway is priority. 22. The client newly diagnosed with epilepsy who works in an office asks the nurse, "What can I do to prevent having seizures?" Which statement is the nurse's best response? L1. I recommend getting about 4 hours of sleep a night. L2. Ask your supervisor to have someone else make copies. L3. Request your employer to provide a work area with dim lighting. L4. You should get your serum blood level checked every month. 22. Correct answer 2. Flashing lights, such as occur with a copying machine, can evoke a seizure and should be avoided. Other causes of seizures include stress, fatigue, and alcohol intake. Serum blood levels will not help prevent seizures, but they do indicate the serum drug level. 23. The nurse observes a client having a tonic-clonic seizure. Which information should the nurse document in the client's chart? Select all that apply. L1. Determine if the client is incontinent of urine or stool. L2. Document the client had privacy during the seizure. L3. Note the time and where the movement or stiffness began. L4. Note the circumstances before the client's seizure activity began. L5. Note the results of a complete neurological assessment. 23. Correct answer 1, 3, 4. The nurse should assess the client before, during, and after seizure activity. Providing privacy is expected and would not be documented in the chart. The client in the postictal state needs rest, therefore, a complete neurological assessment would not be appropriate. 24. The UAP is holding the arms of a client who is having a tonic-clonic seizure. Which action should the nurse implement? L1. Help the UAP restrain the client's upper extremities. L2. Instruct the UAP to release the client's arms immediately. L3. Take no action because the assistant is handling the situation. L4. Notify the charge nurse of the situation immediately. 24. Correct answer 2. The client should be protected from injury but be allowed to move freely. Restraining the client's extremities could result in orthopedic injury to the client. 25. The client diagnosed with a seizure disorder is prescribed phenytoin, Dilantin, and anticonvulsant. Which statement indicates the client needs more teaching concerning this medication? L1. I will brush my teeth after every meal. L2. I will get my Dilantin level checked regularly. L3. My urine will turn orange while on Dilantin. L4. This medication will help prevent my seizures. 25. Correct answer 3. Dilantin does not turn the urine orange. Therefore, this statement indicates the client needs more teaching. 26. The client is admitted to the intensive care unit, ICU, experiencing status epilepticus. Which intervention should the nurse anticipate implementing first? L1. Assess the client's neurological status frequently. L2. Monitor the client's heart rhythm via telemetry. L3. Administer diazepam, Valium, a benzodiazepine. L4. Prepare to administer anticonvulsant medication. 26. Correct answer 3. The client is in distress, therefore, assessment is not priority. The nurse should first administer Valium to halt the seizure immediately to ensure adequate oxygen supply to the brain. Anticonvulsant medications are administered later to maintain a seizure-free state. 27. The client is admitted to the ED after experiencing a partial seizure. Which question would be most appropriate for the nurse to ask the client? L1. Do you know if you lost consciousness during the seizure? L2. Are you feeling sleepy or very tired at this time? L3. When did you last take your seizure medication? L4. Were you feeling jittery or irritable prior to the seizure? 27. Correct answer 3. The nurse must determine if the client has been compliant with medication, therefore, this question is appropriate. The client does not lose consciousness in a partial seizure and does not experience a postictal state. Hypoglycemia, feeling jittery or irritable, causes tonic-clonic seizures, not partial seizures. 28. Which statement by the female client indicates that the client understands factors that may precipitate seizure activity? L1. I should not take birth control pills to prevent pregnancy. L2. I need to limit my intake of dairy products. L3. I should not participate in any contact sports. L4. My menstrual cycle may affect my seizure disorder. 28. Correct answer 4. Because of the fluctuations in hormones that alter the excitability of neurons in the cerebral cortex, an increase in seizure frequency may occur during menses. Content. 29. The clinic nurse is checking diagnostic test results. Which diagnostic test result would warrant notifying the client immediately? L1. The female client who is taking an anticonvulsant who has a low bone density scan. L2. The client who is diagnosed with epilepsy who has a phenytoin, dilantin, level of 28 micrograms per deciliter. L3. The client with a seizure disorder who has a carbamazepine, Tegretol, of 10 micrograms per milliliter. L4. The client who has partial seizures who has a serum sodium level of 143 milliequivalent/L. 29. Correct answer 2. The therapeutic dilantin level is 10 to 20 mcg/dl. A level of 28 micrograms per deciliter requires notifying the client. 30. The mother of a child who had a febrile seizure tells the pediatric clinic nurse, I am so upset because now my child has epilepsy. Which statement is the clinic nurse's best response? L1. Your child had a seizure due to a high fever, not due to epilepsy. L2. You are upset about your child having epilepsy. Let's talk. L3. The Epilepsy Foundation of America provides good information. L4. I would recommend you attend the local epilepsy support group. 30. Correct answer 1. A high fever in a child can cause a seizure, but it does not indicate the child has a seizure disorder. The nurse should provide information if at all possible instead of a therapeutic response that encourages the client to ventilate feelings.